who needs a portosystemic shunt for portal hypertension. Imagine a situation where blood flow through the liver becomes blocked or slowed, causing pressure to build up in the portal vein. This condition, known as portal hypertension, can lead to serious complications. A portosystemic shunt, especially a procedure called a transjugular intrahepatic portosystemic shunt, or TIPS, is designed to help manage these issues. But who actually needs this kind of intervention? Let's explore that. Patients who experience recurrent or severe variceal bleeding are prime candidates. Varices are enlarged veins, often in the esophagus or stomach, that can rupture and cause dangerous bleeding. If these bleed repeatedly or do not respond well to medications and endoscopic treatments, a TIPS can be used as a secondary measure to prevent further bleeding episodes. It acts by creating a new pathway for blood to flow, reducing pressure in the veins and lowering the risk of hemorrhage. Another group includes those with refractory ascites. Ascites is fluid buildup in the abdomen caused by high pressure in the portal system. When diuretics and dietary changes fail to control this fluid accumulation, TIPS can help by decompressing the portal vein, easing the fluid buildup, and improving the patient's comfort and health. Patients with hepatorenal syndrome, a type of kidney failure linked to severe liver disease and portal hypertension, might also benefit from TIPS. By improving blood flow within the liver, TIPS can help restore kidney function in some cases. Similarly, individuals with Budd-Chiari syndrome, which involves blockage of the hepatic veins, may need a shunt if blood flow is severely impaired and anticoagulation alone isn't enough. Other less common reasons for considering a portosystemic shunt include conditions like hepatic veno-occlusive disease, hepatic hydrothorax, portal hypertensive gastropathy, hepatopulmonary syndrome, portal vein thrombosis, or bleeding from ectopic or gastric varices. Each of these conditions involves complications from increased pressure in the portal system that can sometimes be alleviated with a shunt. However, not everyone is a candidate. Absolute contraindications include cases where the procedure is meant to prevent bleeding before it happens, known as primary prevention. Patients with severe heart failure, significant pulmonary hypertension, active infections, or certain structural liver diseases should not undergo TIPS. Relative contraindications, which requiring careful evaluation, include the presence of liver cancer, moderate pulmonary hypertension, blood clotting issues, or severe hepatic encephalopathy, a condition where brain function is affected due to liver failure. The TIPS procedure involves creating a channel between the portal vein and the hepatic vein inside the liver. This helps lower the high pressure in the portal system, reducing the risk of bleeding and other complications. While TIPS can improve survival and quality of life, it does carry risks, especially hepatic encephalopathy, which can occur in nearly half of the patients after the procedure. This happens because blood bypasses the liver, leading to toxin buildup affecting the brain. In the context of liver health and liver cancer, TIPS is mainly used to manage complications from cirrhosis or other liver diseases. For patients with hepatocellular carcinoma or primary liver cancer, TIPS is generally used with caution. It is not a treatment for the cancer itself but may be considered if portal hypertension causes significant problems, always after careful evaluation. Ultimately, the decision to perform a portosystemic shunt depends on individual factors like the severity of portal hypertension, response to other treatments, liver function, and overall health. It is a valuable tool for managing life-threatening complications, but it must be tailored to each patient's unique situation. Always consult with a healthcare professional to determine the best approach for managing portal hypertension and its associated risks.